Blood glucose monitors is one of the early first areas of self-monitoring for a disease solution. Peter Lordy did design the original self-monitoring glucose system decades ago. These glucose Bluetooth connected devices came out probably about 5 or 6 years ago. To my knowledge, BodyTel out of Germany was the first company that did this. So it's been exciting to see that market develop. While the technology is certainly more interesting, the designs are getting better, the question that remains is, from an operational standpoint, from a healthcare system, how to handle all this, this incoming data that our operations process isn't currently designed to handle. Glucose monitoring for the last 30 to 40 years has been a self-monitored solution with glucose diaries, and it's intended to engage the patient and get them to help monitor their insulin dosages really themselves and understand that kind of aspect. Moving all that information into a healthcare system just requires the healthcare system to have a process and a protocol and a decision-making tree about what to do with this incoming data. Easy to conceptualize, still a bit of a challenge to operationalize at a system-wide level. Data these days is increasingly easier to collect. The challenge is ascribing value to that information. Collecting information is certainly one part of the puzzle. Turning that information into knowledge, and then that knowledge into something that really affects what you do, is the path that you have to go through to figure out if it's even worthwhile collecting the data in the first place. You can certainly do recreational data gathering, where you're just gathering it for the purposes of gathering or for somebody's self-interest. But in the healthcare system, we're really looking for, how does that incoming data affect a previously existing protocol or a plan of care? Because if data comes in that it wasn't going to change your decision-making process, or there's no action item to then do, it quickly loses its value. And again, there's certainly a benefit from a research standpoint for collecting massive amounts of data and then looking retrospectively on, gosh, is there a needle in this haystack of data? And all that is probably great from a research, grant, development aspect. But when you move it into the market and you're expecting people to pay for that collection of data, you better have a pretty good reason for collecting it and be able to show that there's value behind it, moreover than just the action of collecting it.